New video which is tips and tricks on loop diuretics. As furosemide, which brand is Lasix.
Administered before a blood transfusion. Blood transfusions complicated by water retention, which worsen heart and kidney function. Diuretic is used as a pre-medication to supplement red blood cell transfusions, especially in patients at risk of fluid overload or pulmonary edema. Loop diuretics. Reduce body water volume by making the kidneys excrete more urine. Prevent complications such as transfusion-associated circulatory overload, where the additional volume can lead to circulatory overload, particularly in patients with compromised heart or kidney function.
Affect thyroid gland. At high doses over 80 milligrams daily, cause low levels of thyroid hormones that associated with symptoms such as tiredness, weakness, weight gain, and increased sensitivity to cold. Causing factors. Inhibit the binding of thyroid hormones to carrier proteins, leading to a transient increase in free thyroid hormones and subsequently causing a decrease in total thyroid hormone levels. Also increase renal excretion of iodine, which decrease the retention of iodine.
اسكت الله يخرب بيت ابوك اسكت 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 انا بقول لك اسكت.
Diuretic resistance, which related to inability to achieve the desired reduction in edema or congestion despite administering an appropriate dose of diuretic medication, which commonly observed in patients with heart failure, and characterized by the failure to adequately eliminate excess fluid and sodium from body, leading to persistent volume overload and edema. In this case, furosemide used intravenous injection with chlorothiazide diuretics.
ده كده عظمة قوي.